So the appearance of double chin is not uncommon in our population. It's something that we do see pretty commonly. Patients with concerns about double chin who want to have the appearance of the double chin reduced. And there are three main reasons why we develop the appearance of a double chin. The first reason is small chin. Having a small underdeveloped chin will result in lack of support in the what we call the submental area, which is the area underneath the chin and between the neck. Most Asians, especially the Chinese population, have smaller chin profiles, and that's why in this particular population we do see more appearance of double chin even in patients who are not obese. The second reason why we can appear to have a double chin is of course because of fat accumulation underneath the chin, and we find that fat in this area seems to be more difficult to lose. So even in patients who have lost a lot of weight all around the body, the submental area can be a very stubborn area to lose. And the last reason why we develop appearance of a double chin is because of skin laxity. That means loose skin in the submental area, and this usually results in the appearance of a double chin, especially when the patient bends down or looks downwards. So in patients with a small underdeveloped chin, the non-invasive or minimally invasive treatment of choice is of course fillers. The chin needs to be properly assessed for the length as well as the projection. Most of the time what we do is we will try to optimize the chin in terms of the length of the chin as well as the forward projection of the chin. So when we combine with these two factors and use fillers to augment the chin, we give better support to the submental area and actually reduce the appearance of the double chin. So in patients with a small chin, very often just a simple filler will actually be sufficient treatment to give a good result. So for patients with fat deposition underneath the chin, there are three main modalities that are available on the market. So of course, firstly is fat freezing or cryolipolysis. This is a process where we use an applicator with a vacuum and subject the area underneath the chin to sub-zero, sub-freezing temperatures. Basically, when we expose or subject the fat cells to sub-zero temperatures, the fat cells tend to undergo programmed cell death, and the body generally metabolizes and clears the fat cells away over a period of a few weeks after the treatment. So this particular treatment is very good for patients with very hard fat underneath the submentum. Second treatment for patients with fat underneath the chin is a laser. Basically, this is a 1060 nanometer laser that is used on an applicator on the submental area. It efficiently breaks down fat, and it also has the added advantage of helping to tighten up the skin, and most patients do see results after about a month or so. So this is useful for patients with some fat underneath the chin and also an element of skin laxity in the area. The last modality involves fat melting injections. These treatments have been around for a while in the US as well as in Europe, but it's not approved for use yet in Singapore. But I heard that it is something that will reach our shores very, very soon. These injections are only FDA approved for small areas like the submental area, and I do not advise using these fat melting injections in larger areas such as the abdomen or the legs. And finally, skin laxity underneath the chin can be treated with a variety of treatments. There are quite a few energy-based devices on the market that can help to tighten the skin underneath the chin. These include HIFU or high intensity focused ultrasound, radio frequency, which is typically used to tighten the face as well. The 1060 nanometer laser, as I mentioned earlier, can also help to tighten the skin and reduce skin laxity underneath the chin. So most patients actually have a combination of these factors, either a small chin, fat accumulation, or skin laxity. And it's important that we are able to assess the patient properly before we embark on the treatment protocol. So I hope we've addressed some of your questions about how to reduce the appearance of a double chin. Do drop in for a consultation with us if you do have any double chin issues, and we'll be most happy to formulate a treatment plan for you.